Hey, New Day, it's Dr. Katie here. I just wanted to send out a message to everybody in our community addressing some of the concerns that many of us are having right now around COVID-19 with the increase in positives, the increased cases, the increased numbers in hospitals. Even receiving today a message from, it looks like the city of Chicago, that starting on Monday that there's going to be a re-emphasis on essential services and activities only. So I just want to talk about our perspective on this and what that means for us and potentially you. One thing to keep in mind is that there is a lot of focus right now, as I've just been saying, on the number of cases. And although I can see why we have a concern about this, because more cases mathematically is going to mean that there is going to be a higher number that end up being severe enough to be in the hospital, being severe enough to have people die. At the same time, again, just considering mathematically and the reality of the situation, is that we've all probably already been around people who have tested positive or who would test positive if they were tested. Whether it's walking down the street, whether it's at Trader Joe's, Whole Foods, another doctor's appointment, etc., that it's almost definitely the case that those of us who have been leaving the house to do certain activities have been exposed in some way or another. I use air quotes because there's a whole range there that could be within the public health world, that they would consider an extended period of time in a closed room with someone who's positive, the highest risk, all the way on down to potentially passing somebody in a hallway or on a street. So just to keep that as your big picture on this, I know that it does feel concerning to hear so much about the cases increasing, but just remembering that it is still true, some good news in this, that for the vast majority who become positive, that this is a asymptomatic or mildly symptomatic situation, that the survival rate is extremely high, and that really the biggest factors that we have control over are not just our own activities in terms of masking and doing what we're being asked to do in terms of distancing, but really taking care of ourselves. That means with our diet, our exercise, getting sunshine and fresh air, being able to have gratitude and positive thoughts as much as possible, be around people who are supportive of us and help sustain us, as well as getting this spine care, getting care from your chiropractor, getting care here, that network spinal chiropractic that we do here. If we are refocusing again on essential, what is being termed essential only, chiropractic will continue to be considered essential, and so it is within the realm of acceptable according to the public health organizations and the government, that you be here for your care, and certainly for us in our perspective, we view it as extremely important that we be able to be here for you and during this time. I just got my adjustment just now with Dr. Virginia, and me being able to be at my best isn't something that for me is optional right now. I'm getting adjusted, I'm exercising, I'm taking supplements, I'm looking and paying attention to what it is I am focusing on and what I'm making it mean, to make sure that it is something that is energizing and helpful for me and to the people that I wish to influence and contribute to. In addition to our regular measures that we do around here, having the air purifier in back, having there be number limits on the areas, everyone has been doing a really great job with remembering to have your mask and to distance in here. We're all getting tons of practice, obviously, on the streets and in grocery stores, and this is certainly a much cleaner and less risky place to be than a grocery store right now. Much less in terms of numbers of people who come in here, as well as the cleaning that does happen. In addition, Dr. Virginia and I are taking on getting tested every week. Of course, we know it's not perfect because we aren't getting results right away in a lot of cases, or we're getting a rapid test result and then a few days later it's possible for someone to get even a different result with the more in-depth tests that they do. But just in an effort to allay your concerns and be able to stay as up to date as we can, of making sure that Dr. Virginia and I are both testing negative for this, then that is what we are doing. I had a test on Sunday, I tested negative, just FYI. And just to continue to be diligent, just like we've all been taught to do over these last many months, making sure that if we are feeling symptoms that we are calling off whatever we have scheduled, and letting people and letting us, the office, know what is going on with you so that we can do our due diligence if and when there are practice members or people who have contact with this office who have been exposed and or are testing positive. That realistically, like I said, just the pure mathematics of it is high likelihood that we're going to be facing more and more of these situations. And so that's why I wanted to send this video out to you today, to do the best that I can to allay your concerns. I know that we all have a different level of concern around this depending on our own health factors and our own lives, and just continuing to empower you to do what is best for you. Ask questions, make comments when you feel it's important, and just know that by coming here and getting this care, especially now, many months into the game with this pandemic, that now is a very important time to be taking care of ourselves from the space of health and building health and immunity, knowing that that is an extremely important component that is not always being addressed fully when we're focusing merely perhaps on avoidance and outside-in based strategies. So thank you for watching and listening, and I hope everybody is doing great this week and was able to enjoy the weather last week and all the positivity that's been in Chicago since the weekend. And we look forward to seeing you here at New Day at your appointments. See you then. Bye.